My fear is that I will either be too out of it or too stunned to ask the right questions or not really know what to do on my own.
They clearly do not have the patient's best interests at heart, except from the perspective of treating them medically.
Without the education of what to do after your discharge. The education part is really important. Trying to reach someone is literally impossible. And I know because it feels like a factory that they're discharging me too soon is also a big fear.
It's happened. Readmission is the worst possible thing that could happen to a chronic patient. They discharged me when I clearly should not have been discharged. And I stayed in a hotel close by. In the middle of the night, I started projectile vomiting and almost choked, to my death. And they readmitted me. And it was really all because the doctor had a number. If I do surgery on you, you leave the hospital in X number of days. He didn't want to ruin his statistics. I can't prove that, but that's what it's about. For a patient, when you go into a hospital as a patient, you basically lose control, which is understood because it's for the betterment of your care. But when you're discharged, you need to gain back that control to aggregate all this information. So I think that if the doctors had standardized rounds so that you knew when to expect them to come, so that you could plan accordingly. Get all my questions answered, and the nurse will write them up. He or she will sit down with me, and I can tell my friend, come to the hospital at 11 o'clock, because my nurse said she or he will do everything at 10:30. So I think standardized morning rounds or afternoon rounds, because doctors come whenever they want, and sometimes that's effective. But for discharge purposes, standardization of when they visit could help patients coordinate their discharge.